Oh, I've got to give a thumbs up. Let me take my camera off. Hold on.
Oh, yeah. Get Dave to put his paw up. Good morning, everybody, and welcome to our Thursday morning webinar. So we're the Devon International Recruitment Alliance. We are an NHS team and we are recruiting international nurses for our providers in Devon. So I'm very excited to welcome Gina Rogers with us this morning. Gina is a community matron in North Devon area, and our webinar today is focused on recruiting nurses into our community nursing teams. So there's going to be an opportunity to hear about all the support and that you would receive, to listen to the information about the hospitals that we're recruiting for, and then we've pre-recorded a professional discussion, myself and Gina, where Gina talks through all of the opportunities that you'll have working in one of the community teams. And then afterwards, you can ask questions at the end. So I thought it might be straightforward just to start by talking about Royal Devon University Healthcare Trust. So we are recruiting community nurses for 2 hospitals that come under the umbrella of the Royal Devon University Healthcare Trust. So that would be in North Devon Healthcare Trust and the Royal Devon and Exeter. So that's the northern part of Devon and the east. So next slide, please. So as I've said, the Royal Devon University Healthcare Trust covers Exeter and North Devon, and our webinar today is focused on recruiting community nurses. So next slide. So just a little bit about the RD&E. You'll hear it called the RD&E, that's the Royal Devon and Exeter. So you'll see in the picture is the beautiful Exeter Cathedral, and that is right in the middle of Exeter city centre. It's a cathedral city, and the RD&E employs about 450,000 people across that locality. They've also got a very large workforce of 11,000 staff. They manage integrated care across a number of sites, so including the large acute hospital and 12 community hospitals. So the RD&E dates back over 250 years, and as I've said, it's situated in the city of Exeter with the River Exe going around the city. It's in the southwest of England. If you don't know where Devon is, we're not anywhere near London. We're about 3.5 hours away from London. Have a look on the map of the UK and you'll see Devon is in the southwest of England, and we're quite a rural locality. It's only about 20 minutes to the coastline and 20 minutes from our beautiful national parks. We really are very lucky to live in the southwest, and the RD&E has got a very good reputation as a provider of innovative practice. Next slide, please. So we're just going to play a little video about the RD&E, and obviously our webinar today is focused on recruiting community nurses into our community nursing teams. So if you could just press play, please, Laura.
There we go, we're all finished there, so just stay where you are.
You can release the finger itself. What we try and do is protect the arteries.
It's not playing, is it?
I can hear the sound, but not see the picture.
That's strange. Okay, hold on.
There we go, we're all finished there, so just stay where you are.
You can release the finger itself. What we try and do is protect the arteries.
Healthcare is a demanding environment to work in.
Every day throws up a new challenge.
The red phone can give us 20 minutes warning for a major incident, a cardiac arrest.
How are you feeling?
We have no idea what's going to happen. You just come on shift and you wait and see.
It's really important to be a team player.
We work with everyone you could possibly imagine here: ODPs, mental health, paediatrics, community services, occupational therapists.
There's a strong team spirit, and I think it's essential for anywhere in any healthcare service that is maintained.
It's hugely important that we all work well together.
Hi ladies. One of the things I really get a buzz from in this job is dealing with really difficult situations and being able to turn them around and hopefully get a good outcome.
How's Mr. Adicott today?
Yeah, fine.
When you see people responding and you can manage their illness so that you improve the quality of their life, that is a truly rewarding thing to do.
When we get feedback that we've made a real difference to the care of that patient, or we've helped elucidate a diagnosis that they were struggling with, that's really rewarding.
Knowing that you've impacted on someone's life in a positive way, just knowing that you've done your best for them is very rewarding.
Okay, we're just going to get you onto the trolley and get you comfortable.
One of the big parts of my life is training.
There is room to grow if you want to grow.
There's opportunities every day to broaden your horizons.
We have a good training programme for anyone that starts in the department that everyone's involved with, lots of study days, lots of learning of new skills and support.
I think that really tells of a good department because they're willing to invest time into developing the next generation.
Innovation is a key part of working in the emergency department. So we encourage people when they come to work here, if they feel that they can make a difference, we're interested in those ideas.
We're sort of up there in terms of new technologies and state-of-the-art surgery.
We do it for the love, don't we? I absolutely love this job.
I think it's easily the best job I've ever had. I really enjoy being a matron.
It's a lovely place to work. There's a really strong sense of family here. Everyone looks after you personally and professionally.
People are accessible, you know who people are as you walk down the corridor, people are friendly.
Everyone says hello and smiles.
If the staff are enjoying their work and finding it a friendly environment, hopefully that rubs off in the care that we deliver to the patients here.
You form relationships, and you form relationships with people you work with closely, and the fact that they're all flexible, they're all willing to go the extra mile, and they're all very supportive means that we can have what we want, which is patient care at our focus.
How are you today?
Okay, fine.
You're feeling a little bit better?
Yeah.
Okay, that's good. I'll see you again. Excellent. Bye.
That's brilliant. Thank you very much, Laura. So we're just going to talk about the second site under the Royal Devon University Healthcare Trust, which is Northern Devon Hospital, which provides acute and community health and social care service in the northern part of Devon. So it's got a smaller population than Exeter, 165,000. So we're about an hour away from Exeter, but we are very unique in that we are the most remote mainland hospitals in England. So we've got a very small organisation here, but again, very innovative, just like the RD&E. And Northern Devon have received national recognition for a lot of quality care initiatives that they've done in the last few years. So if you go to the next slide, please. So we just wanted to recap about what you would be offered. So as part of this offer, this includes all of the previous offer. So if you were coming to work in one of our wards within one of our hospitals in Devon, you would get all of these things. But this has got a slight addition because obviously for community nurses working in our community teams in Devon, you're going to need to drive at some point. Okay, so we recognise you're going to need some driving support, and that is part of the offer. You would be given a supportive driving programme. Obviously, some of you will come across with previous driving experience, and one of our first community nurses that's arriving in August has been driving for over 20 years. So we have developed a bespoke driving programme for her, just to make her familiar with Devon roads, driving on the left-hand side of the road, and also driving down country lanes. So because we are in the countryside and in a rural location, you know, community nurses do spend time visiting people that are out in the countryside, where you may have to navigate your way down country lanes to different farms. So all of that will be provided for you. So as with any other offer through the Devon International Recruitment Alliance, we do pay for your flight to the UK and your sponsorship and visa. You will be given the OSCE training programme, which is a 3-week education programme. You're given opportunity for career development within your own organisation, and we do recognise your previous experience as a nurse, which is quite unusual. So if you're coming over with 20 years of nursing experience, we will recognise 10 years of that, okay, and place you on the salary according to that. So I think that was the last slide, Laura, wasn't it?
Yes.
Yeah. Lovely. So I'm just wondering if I could bring Gina in now. Hi, Gina.
Hi, Carly. Okay.
Yeah, thanks so much for coming along today. So
No
obviously
problem.
we're really excited to be working with you on this initiative to recruit some international nurses to work within your community team. So I know you're a community matron in the northern site in Devon. So I'm just wondering if you could just talk to us just a little bit about your role and the teams and the sort of the patients that you're managing in these rural localities.
Yeah, so I'm actually a clinical matron in the community, so it's slightly different. We have community matrons that work within our teams that look after predominantly people with long-term conditions and focus on admission avoidance and look to keeping people at home, which is most important to our patients. We've also got 7 community nursing teams across the area that myself and my colleague Sam look after. So we work very much as a practice lead with these teams, making sure that the care that they give is of a high standard, good quality, following policy and procedure. And as you say, you know, we are in a very rural area, so there's lots of different situations that we need to consider. Finding people's addresses is a big one for us. You know, it could be out on the most remotest of farms down a country lane, so driving and being able to drive you know, with a good capability is really important.
Yeah, that's brilliant. And so for a typical sort of community nurse on a normal day, how many visits roughly would they do within that working day?
Usually, I mean, it's quite difficult to equate, but usually between sort of 6 to 8 visits, but that very much depends on what the visit is. So it could be a visit out to somebody to do complex wound dressings, that could take a couple of hours, or it could be to provide insulin to somebody who's diabetic, which could be between 15 and 30 minutes. So it is quite difficult to equate. Sometimes we go to care homes, so we might have our collection of visits within that one care home, so that might keep us there for the morning, and then we go off and do individual visits in the afternoon. But as a rule of thumb, around sort of 6 to 8 visits per shift.
That's brilliant, thank you. And I know we're asking for 12 months of community nursing experience for our nurses thinking of applying, or be able to demonstrate autonomous practice, because that ability to work autonomously, sort of on your own, managing your own caseload, it's so very different, isn't it, working in the community compared to working on a ward?
Absolutely, you're having to make your own decisions. Like I previously said, you're having to gain access to somebody's property. You may have to call the doctor, you may have to call the physio or occupational therapist to guide you through your visit. So it's very much thinking on your feet, problem solving, feeding back to your team. There's always a coordinator on shift who can support that nurse who's out there working on her own. So nobody is left to make decisions on their own. And then, like I say, there's myself and Sam that have that overarching support to all the teams.
Lovely, brilliant, thank you. So Laura, are you able to play the discussion that we had with Gina a couple of weeks ago?
Of course.
Thank you. And guys, those that are watching, please don't be shy, pop your questions in the chat and we will answer them as best as we can. And welcome to our Devon International Recruitment Alliance. recruitment focused webinar. So today we have a specialised webinar on recruiting community nurses to our Devon district nursing teams. So my name's Carly and I'm the International Recruitment Lead Pastoral Nurse. Everybody knows Laura. Laura's our project support, and I've got great pleasure in welcoming Gina along today to talk about the wonderful work that her community nursing teams do and the support and things that you're likely to see if you apply for one of these positions. So Gina, I'd like to hand over to you. If you'd just like to talk to us a little bit and explain your role.
Hi everybody, so I'm Gina Rogers. I'm a clinical matron for the Royal Devon University Healthcare, and I'm responsible for 4 community teams across the northern part of North Devon. So quite a large geographical area, very rural, lovely countryside, beautiful beaches. I think you'd want to see.
That's great. And how many staff do you manage, Gina, within those teams? It's quite a large area, isn't it?
Yeah, so there's probably about 200 staff across those 4 teams. So, and they're integrated teams, so they're health and social care teams, so community nursing, community therapy and social care, all working together to provide a collaborative service for patients.
So you've really got that sort of innovative multidisciplinary team working there across all those specialists. So that's really good. So in terms of, you know, the band 5, so the registered nurses that you've got within the team, for those nurses that are interested to work in community, I know that we are going to be requesting that they have got some community nurse experience. So are you able to explain to us a typical day as a community nurse in one of your Devon teams?
So a typical day for a band 5, usually they're allocated their patients the day before, so they've got an idea of what they're doing and where they're going. But as we know with community nursing, that can all change on the day. We have urgent visits come in, we have GP referrals, we have patients that have gone into hospital, so we have to work very flexibly. So our band 5s, sometimes they come into base first thing in the morning. Our shift times are roughly 9 till 5. Some people do 8 till 4, but roughly 9 till 5. So some come into the base and discuss any aspects for that day with their team lead, or they can go out to their patients directly from home. We work with an electronic healthcare record system. So the nurses would go out with their laptops and their phones so that they can always communicate back to the teams, update the team with any changes that may have happened or any problems that they encounter. So any new staff to the team would go out and work with another band 5, so an experienced band 5 or sometimes a band 6. Each team has a band 6 that looks after the caseload and allocates out the patients, and then underneath the band 6 are an amount of band 5s, and then we've got band 4s as well, assistant practitioners and nursing associates, and band 3s. So we don't employ anybody lower than a band 3 in the community because of the lone working, and you know, you basically have to think on your feet and make decisions and problem solve on that day. Yes, we would very much support the band 5. Because with North Devon, it's the case of having to find your way around and getting used to the wide spread of where patients live. So some are based very much in a town area, but quite a few of our teams are very rural, country lanes and farms. Yeah, so quite a lot of things to think about and consider.
Yeah, absolutely, and it's such a rural area, isn't it? You know,
Yes.
Devon, and in particular northern Devon,
Yes.
that you know you do spend a lot of your time travelling and finding people's homes, and you mentioned that importance of being able to make those decisions and be autonomous as a registered nurse. That's key, isn't it?
Yes.
And that's why we are going to be looking for nurses that have got that experience of lone working, because it's very different to working in a hospital setting where you've got the team and you've got doctors around you all the time. So I think that's really key. So in terms of sort of that clinical caseload, so you've explained that the nurses might go in with the team into the hub in the morning and, you know, have the allocation of caseload.
What sort of clinical duties then? So if they're off out to see Mr. Jones on the farm, what sort of things might they be doing?
So that might be wound care management, it could be supporting continence issues like catheterization, it could be administering medication, or it could be end of life care, to give you sort of a broad spectrum. We don't allow anybody to do anything where they haven't completed their clinical competencies. So we would make sure that everybody has completed their theory training for each aspect of the clinical skills, and then they're watched in practice, and then they're signed off by the person who's shadowing them, or the team lead.
That's lovely, great. So there's that real sort of supportive package, you know, when they start their induction in a community team.
Yes.
And I know that, you know, you are going to be looking at recruiting international nurses into community teams, and part of the process would be on arrival is that they're based with the community team that they're going to be working with, but they're also going to spend some time in the hospital as well, just learning about the process from patient admission through to when they are discharged into their own home. So they really know that end-to-end process. And obviously while they're studying for their OSCEs, they would be supernumerary, and like you've said, they will be paired up with someone who will support them through that transition. So one of the other sort of key elements that's important to mention for community nursing is that the ability to drive. So we are not expecting any applicants to have previous driving experience, because you may come with us with 40 years driving experience, but it might be completely different to driving in Devon, and that's quite key. So we will provide you with driving support once you've passed your OSCE. Part of the offer is that we will provide driving lessons and get you through your tests, because that is really key, and an element of this role is being able to visit patients' homes. We're not in a city where you might better walk to people's houses. There will be some walkable distances, I'm sure, in the towns, but not so much as you would find in a city. So that's key. So so at the point that the nurses have passed their OSCE, they've had driving lessons, they've passed their test, they're then out and about, they've got their own caseload, you know, that could take anything up to say 6 months. At that point, I know part of the support is that they would then be popped onto the preceptorship programme, and I don't know if it might be a good time to talk through the community induction programme that you've designed. I know Laura's going to share that. That would be really good. It's a really comprehensive programme there, and for any new nurse joining the community teams, because it is so different.
So what we find in the community is, even if you've worked in the acute hospital for a long period of time, when you come out to the community, you're utilising all of your clinical skills, so medical, surgical and community. And like we've said before, having to think on your feet as well, having to make autonomous decisions about your practice, sometimes having to access somebody's property can be a difficult decision. You know, you don't know if the patient's on the floor, you don't know how to get into their property to start with, you don't know if something has happened behind the door. So there's lots of things that a nurse has to sort of factor in before he or she goes in to complete the clinical task. So we've tried to break the induction programme down into spending time with as many different professionals as possible in the first couple of weeks. So as I said, we are an integrated team in each of our areas. So we would expect the nurses to go out and spend time with a social worker or a therapist, spend time with the hospice to look at end of life care, maybe speech and language, so any of the other professionals that we work with, to get a full sort of rounded experience of what it's like to work in the community. And then as the weeks go on, we would factor in the more complex and specific clinical skills that we have, like wound management, catheterization, use of end of life syringe drivers, those kind of things. So we would build that in over we stipulate a 12-week program. However, it can be as long as the person needs it to be. So if that person needs to have longer time, then that's absolutely fine. We don't expect anybody to do anything that they're not happy to do. And some people Some nurses will pick it up on the first go and say, yeah, I'm happy to run with that and give that medication. Some nurses want to watch again and again before they feel, you know, happy to work with that clinical competency. So that's really important, and we always advocate that in the community, never to do anything that you're unsure of, always report back, always ask for assistance. Even at our level, you know, we're not doing things like they are every day, so I would always say, can you just run through that with me? Can you just go over that? Oh, that piece of research has changed, so we practice differently. And they'll probably find that working in the hospital practice is very different community. For example, something like aseptic technique, we can't do that in the community. We do clean procedures, but quite often you have to factor in the dog or the cat being in the room.
Yeah.
Living environment, you know, may not be as clean as a hospital environment would be. So there's lots of additional kind of judgments and decisions you have to make.
That's lovely, and I think it's really reassuring just to read in your induction booklet here that, you know, this is about the transition of the first 12 months. You know, there is no expectation they're going to all fly through them at the first few months, and you know that goes for any learner. So that's really good, and obviously they can work through this document during that transition period.
Yes. And going on to this particular page, these are all the different types of equipment that we provide the nurses with. So I've talked about the laptop and the phone. They've also got a SkyGuard, which is a lone working device. So if anybody gets in trouble or they need to alert back to their team that there's an issue and they need support, that's really good. And we encourage people to take them out every day. And also it gives you information about the different learning systems and platforms that we use, and other equipment as like blood pressure and temperature, SATS probe, those kind of things that you would take out to do your observations.
Right, go on to the next page. So there's a work-based induction checklist. So again, you know, all of this will be worked through with you. You'll have an assigned mentor within the team, and they'll wrap their arms around you and support you with your learning needs.
Absolutely, and like we've said, people learn at different paces. So those nurses that may be, you know, really confident and happy to go out and take a small caseload after a certain amount of weeks, that's equally fine as people that take, you know, a lot longer. And what we tend to do with people that are very confident and are looking to do more things, sometimes we give them additional roles, so they might become the link nurse within the team for end-of-life care or diabetes care, wound management. We'll get them to link in with those other professionals just to keep that motivation going. So we don't want anybody to get bored or you know, be wanting to do more but held back. So we really encourage that as well.
Yeah, brilliant. Sounds fantastic. Is there anything else in the booklet that you wanted to just go through? So we talked about
it's a really handy sort of aid memoir that they can revert back to, and you know, and tick off and put the dates on so that it covers for revalidation. Absolutely. One-to-one supervisions with their line managers, you know, and if there's ever an issue, because I know obviously we've been quite short-staffed over recent months. We've had problems with getting people to do their training because it's been the clinical practice that's been essential. We've had training come out and do bespoke sessions with us. So if people have a particular need, I don't know, it might be a syringe driver management for end of life care, that they can come out and do that with us locally, so we don't pull somebody away from the team.
That's brilliant, and that's been so important, hasn't it, during these times of acuity, that there is that flexible approach to learning and education in the workplace. So I know a lot of our nurses come over with a vast amount of experience, and they're keen to get their PIN number, and they're keen for that career progression once they're here. So what sort of career progression opportunities will be available to them in the community teams?
So we've talked a little bit about the additional roles they can have as a band 5 link nurse roles, but also they can do individual modules. We work alongside a local college at Petrock and Plymouth University and Bristol University, doing advanced level assessment skills, end of life care, dementia care, frailty, and if the nurse wants to go on and look towards becoming a Band 6, we do the specialised practitioner qualification known as the SPQ, which gives them their district nurse qualification on the NMC register. So there's a lot of pathways to follow. There's also e-learning through the organisation and additional sort of day courses that we can access and tap into as well.
That's great, and I know a lot of them will be very interested in doing that specialist qualification.
Yes.
And one of our great things in the NHS is that these courses are funded, aren't they, by the employer?
That's right. That's right.
And if you want to progress, you know, we will encourage you to do that. That's one of the key things of the NHS. So we've talked in previous webinars. We've talked about QNI, the Queen's Nursing Institute,
Yes.
and I just wondered if you might be able to talk about their involvement in community nursing and the opportunities they also bring.
So this is a fantastic platform. I've been a Queen's nurse for over a year now, and it's great for networking. They are so helpful. I mean, you get to tap into thousands of Queen's nurses across the country to ask questions, attend webinars, go to conferences, look at innovative practice, and it's a great family to be involved with. It's really, really encouraging. And you know, we would look towards any of our nurses embarking to apply to be a Queen's nurse, definitely.
That's brilliant. And yeah, I know that there's a few, isn't there, in the community teams that are Queen's nurses, and
yes.
you know, I think they do offer some really good opportunities there.
Yes.
That's brilliant. So I think I think we just need to sort of sum up really by talking about the offer for our nurses that are interested in working in community teams. So basically we are looking for nurses that have got some community experience. You will be recognised for the experience that you've got. So as an alliance, we recognise 50% of your experience. So if you've got 20 years nursing experience, we will recognise 10. You know, we need you to be a registered nurse in your home country and have completed your OET or your IELTS qualification. If that matches you, then please get your application in. We will advertise the link along with this webinar. But you know, I don't know if you wanted to sum up, Gina, about working in North Devon. I know you've worked in North Devon as a nurse for your whole career, so I think that speaks volumes.
Yep, 30 years now since I started my training, and you know, across a broad spectrum, not just in the community, but in the acute trust, in the private sector, managing a care home, working with the local colleges, teaching from a clinical point of view as well. So yeah, it's a great place to work, lots and lots of opportunities, and the work-life balance is brilliant. So you know, obviously we've seen in the press loads of stress related to what we've come through in the last couple of years, pandemic, but if you can live and work in a really nice area, that makes such a difference.
Absolutely, and I think for those families, for those nurses that be looking at bringing families over in the future, it's a great place to raise a family.
Very safe, you know, great schools, lots of opportunities.
So if you like the sound of this, get your application form in. Both myself and Gina will be shortlisting those applicants and booking you in for an interview if you fit the relevant criteria. So huge thanks for Gina for coming along and talking to us today about all the wonderful opportunities in the Northern Services, which are under the Royal Devon University Healthcare Trust. So Gina, I'll let you go. I know how busy you are, and we'll speak to you soon. Thanks, Gina.
Okay. Thank you.
Thank you, Gina.
Lovely, brilliant. That was great. So I hope that's given some of our viewers a bit of a taste of the opportunities available as working as a community nurse in Devon. So the applications are open. It's been open since last week. So Laura, would you kindly just share the link in the chat? So any nurses that haven't applied yet but would like to, get your application form in. We've had a lot of interest.
So I'd urge you to get your application form in as soon as possible. We also spent some time at the OSCE training facility a couple of weeks ago. So remember, all of our webinars, if you haven't been able to watch it live because of working or other commitments, they're all available on our Nursing in Devon YouTube channel, which is free for you to watch. I think there's over 40 webinars on there now. Really good educational support. We've got teaching support on there from dementia nurse specialists, OSCE training sessions. Please go and have a look at that on our YouTube site. Follow us on Facebook. We've got a Twitter account, Instagram, and I think we're just new to TikTok. So yeah, watch this space. So Nursing in Devon. So remember, when you look at our social media, give us a like, give us a love, give us a share. We've covered all of the questions that we had in the chat. A lot of people will watch us at a later date. So again, a huge thank you, Gina, to you for coming along and talking about the vacancies in your teams. And I really look forward to working with you and shortlisting these applicants.
Definitely.
Lovely. Thank you. So stay safe, everybody, and we will see you soon. Bye.
Bye, everyone.
Bye, everyone.